Should patients stop all activities when in pain to avoid more damage? A key challenge in clinical practice is the common fear among patients that moving while in pain will make their condition worse or cause further damage. This belief, which is common among people with persistent pain, often leads to an unnecessary reduction in activity, which can help to perpetuate the problem. Let's see how to get rid of fear of moving. 1. Movement can be uncomfortable, but does not necessarily mean further injury. 2. Inactivity leads to muscle weakness, joint stiffness, and reduced capacity for daily activities, increasing pain. 3. Regular physical activity is key to good management of chronic pain. Adjusting movement intensity and pacing may help patients to find a balance between rest and activity. 4. Avoiding activity due to fear reinforces disability and delays recovery. Think of movement as experience. If your patient focuses on the times when it hurts and not on the times when movement does not increase the pain, painful movement becomes the memory he or she remembers best. And 5. Some conditions like acute injuries require temporary rest, but complete inactivity is rarely beneficial. Therefore, no matter the condition, it is essential to find a way to balance movement and function with pain. How to adjust activity in patients. 1. Explain that adapting activity levels can help maintain strength and mobility without aggravating pain. 2. Introduce graded exposure to movement during recovery within the patient's tolerance, encouraging the patient to move. Help them shift focus from the fear of pain to a realistic expectation of how often pain is really aggravated by movement and how quickly the pain resolves afterwards. 3. Guide them in distinguishing between protective pain responses that are helpful and those that are excessive for the patient's condition. 4. Highlight how mobility improves circulation, muscle conditioning, and overall resilience. And 5. For some people, moving without pain is not always possible. However, being able to control or foresee when pain will increase and feeling competent in controlling pain that flares up gives these patients tools to self-manage their pain, which in turn helps them feel more in control and less restricted. Let's put it in practice. James is a 50-year-old man who stopped most physical activity due to knee pain 5 months ago. He is afraid that any movement will make his condition worse, and he believes that pain is a good indicator of how well his knee is doing.
James, I understand that your knee pain makes you cautious about movement. But did you know there are ways to move your knee that will strengthen the area more comfortably?
I thought I should avoid all movement to prevent making it worse until the pain goes away.
I hear you. Resting too much can weaken your muscles supporting your knee. A better approach is controlled movement. For example, using a stationary bike at the gym with low resistance for 5 to 10 minutes can keep your knee mobile without stressing it.
I never thought about that, but what if I still feel some pain?
That's a great question. Some discomfort is okay, but if it takes a long time for the pain to settle after you've done activity, that could be a sign of doing too much. Unexpected, persistent, dull pain could also be a sign of aggravation. If this were your case, we would adapt the exercise. For example, by standing with your back against the wall, bending your knees slightly, and holding the position for 10 or 15 seconds and repeating it 3 times. This strengthens the muscles around your knee safely.
That sounds doable. I like that it's something I can control.
Exactly. Let's give one of these a try and see how it feels.
To sum up, as healthcare professionals, we must guide patients away from fear-driven inactivity and towards safe, adaptive movements. Encouraging load management and progressive activity leads to better outcomes and improved quality of life.